Hello, welcome to session 7. That is Common Childhood Diseases Part 4. In this session, we are going to look at typhoid fever and meningitis. This is the reading list. Typhoid enteric fever or enteric fever. Some people call it typhoid, others say enteric fever. Is an acute bacterial systemic infection caused by Salmonella typhi and paratyphi. Epidemiology. Typhoid fever is commonly common among children between the ages of 5 to 19 years. It is more common in males, but carriers are mostly females. Mode of transmission is fecal-oral. Incubation period is 10 to 14 days. Let's look at the pathophysiology. The typhoid bacilla enters the lymphoid tissues of the intestines, mainly the ileum. The Peyer's patches become swollen or inflamed and necrosed with ulceration, which leads to hemorrhage or perforation. The bacilla also enters the bloodstream through the intestinal lymphoid tissue and infects the liver with focal necrosis. Infection may lead to enlargement and congestion of the spleen. Mesenteric glands and lymphoid glands also becomes enlarged, and there is destruction of the bacilli in the reticuloendothelial cells, promote the release of the endotoxins. Clinical features. Usually onset is gradual but may be sudden in children. Temperature rises gradually to a high fever and persists for weeks. Fever does not respond to anti-malaria drugs. So sometimes they come to the hospital, we treat them for malaria, they go and take the malaria treatment, and they come back telling you that they are still having temperature, headaches, and so on. You need to probe further and investigate for this particular condition. There is headache, there is bodily aches, constipation in early stages, there is vomiting, and there is loss of appetite. I might say they present with most of the signs of malaria. There is abdominal pains and diarrhea in the second week. There is abdominal distension. Tongue may be coated. There is dry cough. There is rashes called the rose spot, and it may be seen on the chest and the abdomen. Still on the clinical features, child in the second week may become delirious or drowsy. Fever may last for 3 weeks and gradually calms down. The spleen may be palpable, liver may be enlarged, and there may be mild jaundice. Diagnosis, you have the urine, stool, and culture, blood culture. For bloodhounds, BF for MPs to rule out malaria, and white blood cells count. You can also use the clinical manifestation and with that test, which most of the doctors are not comfortable with. They said it's not reliable, but it's because it must be repeated in 10 days, and they can't wait for these number of days before they start treatment. And then stool and urine cultures can be done, and ELISA test as well. Management, barrenness, and disinfection. You have to tepid sponge for high temperature. Hydration, you have to give adequate fluid. You maintain strict intake and output chart. Then for the drugs, we give oral Cipro 10 mg per kg for 14 days. Or IV Cipro 10 mg per kg may be given in severely ill patients who cannot take oral medication, but should be reverted to oral medication as soon as the patient is well or can tolerate it. Someone may ask why Cipro, because they know that Cipro is contraindicated in children. It's not so. That's what most of us think. Children can take Cipro with caution. Cipro may really cause tendinitis. At the first sign of the pain or inflammation, the drug should be discontinued and alternative treatments such as ceftriaxone should be given. You can also give Rocephin or Zenat to children with typhoid. Then, still on the management, diet, you should give a light and nourishing diet, which will be high in protein, calories, and low in residue, and should be taken in bits because you see they have lots of appetite and vomiting and so on. So you should be given in bits. You should observe the child for vital signs. You should observe the child or monitor the child for vital signs. Input and output chart should be maintained. Abdominal pains, signs of shock, signs of dehydration, mental confusion, and convulsion. You should also monitor for signs of intestinal bleeding and perforation. Let's look at how typhoid can be prevented. You have to just improve environmental hygiene and sanitation, discouraging of fly breeding, supply of safe water, routine screening of food vendors because they can be carriers, especially in our schools. Discourage indiscriminate passing of urine and stools, and hand washing should be ensured, and proper food hygiene should also be ensured. Let's look at complications. You have convulsion, confusion or coma, shock, there is cardiac failure, there is pneumonia, there is osteomyelitis, anemia, meningitis, intestinal perforation, and intestinal hemorrhage. So that is that for typhoid fever. We'll move on to our next topic, which is on meningitis. Meningitis is the inflammation of the meninges, and it can be caused by either bacteria or viral agents. The causative organisms include E. coli, streptococcus, staphylococcus, and the rest. Clinical manifestation include high fever, but we should also know that the onset is very sudden. There's also headache, there's malaise, there is vomiting, there is restlessness, irritability, the child can convulse, there is photophobia, and there is positive Kennan signs, and all the rest. Then diagnosis, we have clinical manifestations. You can use it to diagnose lumbar puncture for cerebrospinal fluid. 4 blood counts can be done, CT scan, and blood culture. How do you manage them? Barrier nursing in caring for the child is very, very important. So it means that you have to also isolate the child. Then frequently assess the following: physiologic status, the vital signs, level of consciousness, because some of them can be unconscious, IV fluids to replace fluid loss, and then complete bed rest with raised and padded sided rails. Then group nursing activities. We don't want to disturb the patient, so we group the nursing activities. Then maintain a calm and quiet environment with dim light. Then NG tube should be passed for feeding. Still on the management of meningitis, you have to suction frequently to prevent aspiration of secretions. Then you tap a sponge when temperature is high. Provide emotional support to child as well as the parents. You maintain strict intake and output charts. You keep fit charts to monitor for seizures. You know, they actually convulse, so you keep the chart to monitor for seizures. Then you give antibiotic, ceftriaxone, 150 milligram per kg per day. Then you give antipyretic, analgesic, and anticonvulsant. Prognosis. The prognosis depends on when treatment was initiated. Children with bacterial meningitis show distinct improvement by 10th day with appropriate antibiotic therapy. Complications include shock, myocarditis, hydrocephalus. Complications include shock, myocarditis, hydrocephalus, neurological defects such as blindness, speech disorders, hemiplegia, and deafness. Then there is also developmental delay, learning problems, and a subdural empyema or effusion. So today we have been looking at typhoid fever and meningitis. You are expected to read on convulsions and conditions of the mouth such as stomatitis, gingivitis, and dental caries. Thank you.